Hi, everyone. I'm the director for Common Knowledge Trust, and it's really our obligation to talk about the coronavirus. We've been online for 20 years, and we hold all of the birth preparation and birthing and birth coaching skills that hundreds of mothers and fathers developed in the early 1970s for absolutely all births. We had defined skills that worked across the board in this particular arena of pregnancy and childbirth because 100% of pregnant women will give birth one way or another. Now we're at a different time at the moment. There's still pregnant women out there and those giving birth, so it's really important to encourage those women and men and families to become skilled because you'll have more confidence and you'll be able to work through the activity of birthing your baby. And at the moment, we're all working through the activity of dealing with this virus globally. And it's really important for us to have skills. And what's one of the most important skills for us to have at the moment? And that's called the gift of fear. When we have fear, we become absolutely blind, deaf, and dumb. Fear stimulates the sympathetic nervous system, the fright, flight, fight, or freeze. And we can't actually afford to do that, particularly for adults. We have to make certain that our children feel emotionally safe and are able to handle the fact that many and most of them are going to be out of school for perhaps months, which puts us out of work as well. So many of us are just plagued with rampant fear. We don't know what's really happening, and we're not certain what anybody is saying to us. However, there is a gift in fear, and that's one of the things that we want to talk about, because when women are pregnant, the natural birth movement tells women, don't be afraid of birth. Women have always birthed. Well, humans have always gotten sick as well, and some have died from being sick. So we have natural fear about these things, and we can understand it also as a gift. So how can fear become a gift? Well, if we acknowledge our fear, if I feel afraid, then I have to just say, I feel afraid. I can say it out loud or to myself. And then what I have to do is to recognize that that fear is actually making me more observant. That can be called hypervigilance, but really it's observance. It means that we are in a situation where we have a concern, small concern or a big concern. And when we become observant, we can then make better decisions. So we are hardwired as humans to have fears. But when we become observant, when we are fearful, then we get to ask a very, very simple question. Is my life or my friend or child's life immediately at risk within 5 minutes? So that's the question we ask when we look at fear as a gift and become observant. Am I or someone I know or love at risk of dying or being seriously injured in the next 5 minutes? If the answer is yes, then of course you seek immediate help or do something immediately. But if we're going to use the gift of fear, we need to distinguish between right now, soon, maybe, or later. Because if we think that everything is right now, then we're not distinguishing fear from just a bland emotion which is just overriding us, or one which we can use to be observant and make decisions. So if the answer is no, then you have to ask the question over a slightly extended period of time. Am I or someone I know or love going to be dead or seriously injured in the next 12 hours? And if the answer to that is yes, then seek the appropriate help or do something about it. If the answer is no, however, the fear won't necessarily go away until the issue that you're afraid of resolves itself. So during these months of isolation or social distancing, we are going to have fear crop up again and again and again and again. We want to use it as a gift for ourselves and others, and we want to teach others. We want to go by the Koto principle, K-O-T-O, know one, teach one. If you have friends or loved ones who are afraid, teach them about the gift of fear. Teach them to ask, is something horrible going to happen in 5 minutes? Seek help or do something. If the answer is no, ask, is something going to happen in 12 hours that's horrible? If the answer is yes, do something or seek help. But if the answer is no, then you need to just remain observant and put more skills into place. So what are some of the skills that we are understanding more and more about with this virus, and if you've contracted the virus? The symptoms are a bit vague, just as flu is a bit vague, but they do know, the scientists do know, that this virus comes in through the nose or the mouth or the eyes. And since mostly we breathe in and out the nose and our eyes are mostly open, then the likelihood is it comes through the nose. Now, only 14% of the people actually had a sore throat, which for most people means they have a sore throat back here. But if it comes through the nose, that means that it's going to go through the mucous membranes to where the nose and the mouth join, back in there, up there. And if that is sore, if that feels uncomfortable, or if where you put your back of your tongue up at the roof of your mouth, where the nose holes come through, if that area is sore, that soft palate, the roof of your mouth, the back of your throat, not necessarily in your glands, if that is sore or it feels raw, then it's really important for you to be gargling with warm salt water, because scientists know that bacteria and viruses, and this is a virus, gather and multiply in the back of the nose and in the throat before it enters the body in this particular virus. So it's important that you gargle as soon as you have that sensation. And then that sensation may ease for a while and then come back, in which case you gargle again with warm salt water. And you can also snort up some salt water into each nostril like that. If you have a child or an elderly person who can't do it, then just take some either dilute vinegar, dilute baking soda, or dilute salt water and put it up just a little bit up into your nose, because the virus is going to come in somewhere. And if it meets that change in environment that's a little bit acid or a little bit basic or a little bit salty, it may be that you're able to keep some of the viruses from penetrating further. However, if they do penetrate further, for those very first few days when you may have initially fatigue, you recognize fatigue. And you need to recognize, do you have a rawness or a soreness in the back of your nose or in your soft palate at the roof of your mouth or where your nose and mouth join? And if you do, then gargle with warm salt water several times a day. Doctors, nurses, dentists have told us that for years, but most of us have just really fobbed it off. What we've done is said, oh, I have a sore throat. It's okay, I'll manage. I'm going to wait to see what happens in a few days. And if it gets worse, I'll go to the doctor and they'll give me something. And too often they're giving us antibiotics for viral infections. Now they know that antibiotics don't work with viruses. So what's our responsibility as human beings who are living on this planet together? And that is to reduce and prevent issues from possibly becoming problems. And we can be our first responders. We need to cut down the viral load in our body. And in order to cut down the viral load, we need to use that gift of fear. We need to become observant. So we need to be able to notice whether we have a soreness in the back of our nose and whether we have a soreness on the top of the roof of our mouth or in the back of our mouth, not necessarily a sore throat as we classically feel it. And then we have to take action, use skills, and that's gargling with warm salt water. Now, Common Knowledge Trust, we're a New Zealand NGO, we share what is very broad. So if you have other skills to use, then use those skills as well. What we know with this virus is we have potentially 3 to 5 days once we have contracted it to really do something for ourselves. And we are not being given that information. We're being told, wash your hands or sneeze into your arm. That's not giving us the skills to self-health. And it's important that we do those things for ourselves and for our friends and our loved ones, is we have to be observant. Use that gift of fear to be observant. And if we have any rawness or soreness where this virus comes in, then we gargle with warm salt water right away, and we tell our friends, co-workers, neighbors, children to do the same thing and to just check in with each other so that we are doing that. And if possible, sniffing up some light salt water up your nose, which cleanses your nose all the way to the back. Now, if you don't have this virus and you have an allergy, which doesn't multiply, these simple things can still help you feel better. So it's attached here, and we want you to pass on to people that fear itself will paralyze us. It will cause us to have fright, flight, fight, or freeze. When we use the gift of fear to become observant, it will calm us down, and it will stimulate the parasympathetic nervous system that opens our blood vessels, opens our breathing, calms our mind down. And that occurs because as humans we thrive on becoming skilled and being skilled. So please pass on these skills to others. Our NGO cannot do this ourselves. We need to have skills with each other and be able to have them in the broadest sense of the word and applicable. So the gift of fear is one of them, and the other is, as soon as you feel anything in your throat or nose, then gargle with warm salt water, and if possible, sniff a little light salt water up your nose, and keep doing that for the first 3 to 5 days. And hopefully by doing that, you can prevent yourself from getting sicker or others around you, because you've reduced the viral load in your own body, and anything you may cough or sneeze out. Or if you get sick, you may get less sick. And in fact, you may know that, because many of us have been told to gargle with warm salt water, even if we've had a wisdom tooth taken out. And we know when it gets sore and uncomfortable and we swish with salt water, it feels better. So we already have this experience. That's why these skills are broad and acceptable to all of us as human beings. Talk to you again tomorrow.